spike in COVID-19 infections, which experts find worrisome. The health department says it's too early to tell whether the new UK variant is the culprit.
Based on the monitoring of the UP OCTA research, there's now an average of 147 daily new cases in the province.
Mahirap tayo magsabi ng mga factors kung bakit tumataas at masasabi pa natin na baka variant yan hanggang hindi tayo sigurado because this might cause panic dun sa mga tao.
Cebu City and the whole Cebu province are currently under modified general community quarantine. But the OCTA research group says that the area is now a case for serious concern due to the increasing COVID-19 cases. The regional health department assures the public that the emergency response is adequate and the healthcare system is up to the challenge in case the increasing trend continues.
In other parts of the country, the status remains under modified community quarantine, but Metro Manila and the Cordillera Administrative Region, where most COVID-19 variant cases are recorded, will be placed under GCQ starting next month, along with 4 other regions. How can other localities manage under the threat of the COVID-19 variant? We discuss in this episode of The Chiefs.
And welcome to this weekend edition of The Chiefs. Of course, with us tonight is Robbie Lampay of One News here in the studio. And of course, Ana Marie Pamintuan of the Philippine Star from the port area in Manila. Ami, Robbie, happy weekend.
Happy weekend. Malapit na. Happy Friday.
Malapit ng Lunes.
Weekend na.
Well, I suppose our big story for tonight, both in Big Story and in the Philippine Star, is still has to do with COVID.
Yeah, yung GCQ na finally announced already for Metro Manila.
That's for the whole month.
Until the entire February. Although this was expected na, di ba? Ito yung rekomendasyon ng mga mayors.
But what are we hearing for Cebu? Cebu now is is under MGCQ, di ba? Is it going to change anytime soon, especially with all the reports of increase in cases in COVID-19?
Well, based doon sa nabalita natin kanina sa big story, it remains under MGCQ. MGCQ pa rin, notwithstanding the but ayun nga, we'll get into that later with our guests. Pero mataas yung reproductive rate doon sa 1.61.
What about you guys, Ami?
Yung iba pa, since mga professor ng UP itong mga guests natin, merong agreement yung AFP sa UP Los Baños to cooperate in the various activities. Na of course, kasama na dyan yung gulo sa red tagging, and another ranking official of the AFP was relieved. Well, he resigned. Actually, he quit his post dahil na after the relief of the intelligence chief.
Yeah, J7. I think you're talking about J7, yung civil military operations. This is actually the group that published that Facebook post.
Yeah. Tapos yung sa AstraZeneca, talaga puro COVID yung AstraZeneca na sinabi ng Germany, di ba, na hindi daw dapat ibigay sa 65 years or older, but this is being disputed by Britain na ginamit na kasi yun sa mga older than 65 and being disputed by AstraZeneca itself.
Marami talagang story sa COVID. I mean, including, among other things, pag-usapan natin yung the overall response. Of course, one big story also had to do with Benjamin Magalong, contact tracing czar. We started the day with him saying that he will resign, he will step down.
Irrevocable resignation?
Irrevocable later on, it was updated, lininaw niya, or irrevocable. But we just read the news tonight na as it stands, as far as the task force is concerned, they have not accepted and he will stay on. Dahil sabi ni Secretary Galvez, hindi natin mapapalitan niya si Magalong. So, as per the latest news, notwithstanding his irrevocable resignation, he is still the contact tracing czar.
Well, hindi ka naman ni-revoke. Ni-reject. Okay, of course, the topic still is about COVID-19, and so let's bring in our guests tonight. We bring in our first batch of guests, of course, from OCTA Research, our mga suki actually. ang ating mga sukay, si Professor Guido David at si Professor Ranjit Rye ng OCTA Research Group. Professors, again, welcome back to the Chiefs. Dapat nata, ano kayo,
Regular
co-host
na,
nata, dapat kayo dito.
Dapat ata may show na ata kami.
Vacation yan ang problema ng bansa.
Well,
Okay.
Professor, let me start off with that. Yun nga po in your last report, you did raise some concerns that baka yung nangyayari ngayon sa Cebu is, it could be because of the UK variant. Can you run us through your findings? What makes you raise that concern na baka UK variant na to? I suppose we're talking here about patterns, no? Kasi we're not naman in the medical field. We're talking about patterns and numbers.
Yes, and I'll take that question. And if you're ever going to ask me about yung DND and yung red tagging, si Professor Ranjit na sasagot.
Sige.
I mean, if
Hoping
ever
to pass that on to you, man.
nahagis ka na agad preemptively. So about COVID, sige, we can manage that. So yung naman about this possibility of the UK variant, I just want to reiterate, we're not trying to scare people.
Mm-hmm.
In fact, we are very careful about our statements. If we want to fearmonger, we would say na, okay, it's everywhere in the country. It's in the Metro Manila. In fact, we're only saying right now 2 possible places na are suspect for the UK variant. And before, we even mentioned yung Mountain Province, and it did show na, so it turns out na andun nga yung UK variant. So before it was identified. So we are careful about what we say. Now we're not saying that the UK variant is in Cebu.
Mm-hmm.
We're just saying that the patterns of increase are concerning, and it may suggest the possibility of the UK variant being there. It's just a possibility. There will be no confirmation until we get the genome sequencing. That is the smoking gun. Kumaga sa law, parang circumstantial evidence lang or something, or parang suspicion. But the smoking gun will be the But right now, the Cebu is having serious concern because yung cases nila for the whole province is 150, and I heard the governor say na yes, we should delineate between cities, and in fact we saw na the city, Cebu City, is averaging 75 cases per day. This is actually half of, close to, they're about close to 200, which is when they had the ECQ last time. And their positivity rate, I just checked right now, it's tumaas na ulit. It's 7%. They were at 1% positivity rate in December. Now they're at 7%. They're averaging 2,500 tests per day. And yung indicators nila are going up, and we're really concerned about that. So Cebu City in particular and Mandaue, ito yung mga areas of concern na LGUs dito sa...
Professor, speaking of that, the circumstantial evidence, because I do recall na, last week, that over the past 2 weeks, you were saying there was that circumstantial evidence to be concerned na baka meron sa Mountain Province, just basing it on the numbers and the trends that you were looking at. Ngayon, when we talk about Cebu, we mentioned the R0 is at 1.61. I'm just curious, what's the dreaded number? Is there a threshold number as far as the R0 or the positivity rate or any other metric that causes you to say na pagka tumungtong ito sa numerong to, that's when we might say there might be that circumstantial evidence to be concerned?
Well, yung R0 tumaas na ulit. It's now 1.65 kasi kaka-release lang ng latest data, so tumaas siya ng konti. It's more of the yung pattern of yung increase nila in most countries where the variant has been identified. Yung cases almost double every 2 weeks. So ganun kabilis. So and this is more or less happening in Cebu right now, in Cebu City also. It's also happening in Cebu City. And that's why we're concerned because right now they have 75 cases in 2 weeks. If we're not careful, it could be 150. Malapit na sila sa level ng when they had the ECQ last time. I'm sure nag-scale up na yung hospital capacity nila and maybe yung frontliners nila, but it's still something to be concerned about.
Yeah, but Professor Rye, in the meantime, as we mentioned, Cebu officially, as of this evening is still under MGCQ. What should be the immediate response when, as you said, hindi pa to smoking gun, but nonetheless, there's that compelling reason to be concerned. What should be the instinct and the protocol once that kicks in?
You know, it's one thing to first of all, we want to clarify. We're not saying it's there now. What we're asking is for government to start investigating through its own institutions, if indeed through sequencing, if they can get access to samples, if indeed the variant is already there, because it's a game changer, Robbie. If we understand that it's there, the response has to be implemented in a timely and appropriate manner, no? And we feel that the hospital capacity has to be increased. They might need to consider a stricter quarantine classification if indeed it is spreading there. But we're not saying it's there yet. What we're asking is for government to start investigating that possibility, because we're seeing a pattern. Okay, number two, there is the standard response, and we're very confident that Cebu will be able to respond, because they've been in a situation of similar to this in the past, and they've been able to successfully, manage a significant surge last year. Is really testing, tracing, and isolation. That has to be undertaken. For the communities, is to continue vigilantly and with discipline, to be vigilant and to be disciplined with regards to implementing minimum health standards. And this could be a product of a post-holiday surge, which we thought would happen in NCR, but it's now happening in Cebu. And so those are the things that need to be undertaken by government, the local government there. And for the national government, it really is providing support. Cebu is experienced. It's in a much better position now to deal with any surge, because it has experienced one last year. In terms of, it's still better prepared than most local government units, and we're confident that if they're seeing the same things that we're seeing now, that this will be dealt with within the next 2 weeks. But we have to find out also, investigate what's the variant that's spreading there. If it's, hopefully it's not the more contagious UK variant. So this is the framework that this is a perspective that we're trying to share in OCTA. We're doing this on a weekly basis. This is the thing we're seeing. It's a big jump from last week and from, let's say, a month ago. And so that's why we're sounding the alarm bells, the red flag. Let's see what's happening. And as far as Cebu was concerned, we were also one of the first groups to see this when they had a surge last year. So we were already calling it 2 or 3 weeks before, and and it did happen. When it happened, it was a significant surge, cost a lot of lives, and was a wake-up call for not just Cebu but also for many local government units. And the response was massive, and the resources needed was also massive. They had to get resources from the national government. We're really hoping that this won't be the case this time. If we...
Professors, compare naman natin dun sa North, sa Cordilleras. Doon yung unang-unang variant local transmission But your report says na the cases are leveling off. What do you mean exactly, contained na ba yun? Is that what it means? What's the situation naman sa Bontoc?
Yes, Amy. So we're actually happy to report that the cases are actually either the growth is slowing down or leveling off, or in fact, in some areas, it's actually decreasing now. For example, in Pangasinan and Benguet, the cases are decreasing. The positivity rate is now decreasing. So we feel na for the moment this is contained, and we laud the local government there and the Department of Health for their timely response, because they were able to sequence the cases quickly, and this has helped them identify the underlying variant, which we were suspecting na andun na. And because of that, they were able to have a quick response, and they were able to have a lockdown, and this has controlled and mitigated the spread of the cases, and this has prevented possible infection in other nearby areas, and this is very important. So we're not just protecting Canary Bontoc, but they're also protecting the other adjacent LGUs and provinces, and that's very important in this pandemic management. So right now they're starting to look okay. I mean, starting to improve. We're not overly concerned about those areas. They still have to practice health protocols and observe these things. Pero as far as the trends are concerned, it's starting to trend in the opposite now. I mean, it's starting to trend downward instead of upward.
But sir, have you seen any other towns or cities that have shown suspicious patterns similar to what you have seen in Cebu that made you raise this concern, at least in concern, no? Because like we said, you are talking about the patterns and numbers, and these are the red flags. Have you seen any such numbers that are similar in other LGUs?
Yes, yung clustering yung hinahanap namin, and one place we saw, the province is in Iloilo, so we looked at it, and it turns out it's not in the Iloilo city, but it's actually in Pasig. And in fact, as we checked that, I also heard on the radio kanina na they're under ECQ, they had to go to lockdown. There were a high number of cases found in the local market yata. And I think they got 160 cases in 2 days, which is huge for a small LGU Pasig. So this is definitely an area of concern. It's not necessarily the variant, pero whenever you have clustering and a surge in cases, isang suspect yung variant. I mean, that's one possible explanation. We're not saying it's the explanation.
It's not the only explanation. Yes.
But right. Professor, all of this hypothetical, we're with you in stressing that and so on. But hypothetically, once you see those numbers, I mean, that's how many days behind whatever phenomenon is behind it?
Well, testing now is faster than before, so mas mabilis na yung turnaround time. So I don't think we have like 1 week delays like before. I think the delays now are maybe a few days. And that's why, this is very important to have timely response. And I think they were able to do that in Mountain Province, a timely response to mitigate the surge. And I think they'll be able to do this in Pasig because they responded quickly naman. The local government is aware of the situation, and I think they're responding adequately to this.
In the meantime, the government announced today that we will not extend the travel ban on countries where the variant has been reported. Do you think this is a good idea? February 1 daw, okay na ulit.
Sir, I think you're muted. Professor Rye.
Mute ba ako?
Si
I think this is a risky, again, decision to make. And in my view, given what we know about the UK variant, what we know of its spread in the Philippines at the moment, and the potentials for, the catastrophic potential of a community transmission with this kind of variant, I think it's not just risky, it's contrary to sensible epidemic management. And I hope that the government will rethink its position on this issue. And the government does rethink, in fairness. After they get enough data, they tend to change their positions on issues. The most recent, of course, is the decision not to let children below 17 be out in GCQ areas, in MGCQ areas. So I think this is a key issue for me. I think we should have stricter border controls now more than ever.
But Professor,
this is just my opinion.
February 1 is just 2 days away, and it's the weekend coming up. So any change in policy might not be forthcoming in the next 2 days.
Yeah, that's why I'm articulating my basic disagreement with it. No, this is not the right time to change policy towards to be liberal about policy, given that so much uncertainty is there. We don't know if the variant is already spreading in our communities. We don't know the nature of we're seeing a lot of outbreaks all around the country, this is not the best time really to become liberal about border controls.
Hey, Professor David, kanina nabanggit mo, okay, we're no longer 2 weeks behind on the data. We're no longer 1 week behind. We're probably a few days. I'm just wondering, now with saliva tests there and the promise of cheaper and faster, and this is the closest we're getting to real-time results, will that have an impact as well in our ability now to monitor and, for that matter, to make quick decisions?
Yes, definitely, Robbie. Yung quick response, quick turnaround time for the saliva test will definitely be a huge plus for us, and we're looking forward to that. And of course, I also can't say enough about how much the Department of Health data has improved over the past months compared to, let's say, in the early goings, na medyo a little rough in data, but now it's a lot improved. So I have to commend them on that.
And that refers to both speed and granularity?
Yes, yes. Before, there were a lot of, you were always complaining about cases na walang city or walang province. But now I think they've reduced that to very negligible levels already.
Well, Professor, one last question. Is it possible na, kasi I suppose government officials thought that they found a solution to the testing issue when they decided to defer by 5 days yung testing for arriving passengers. And with that, maybe they do think that with this, they're able to cover now the incubation period. Does that make sense to you?
No, it doesn't actually. In my view, no. I think we should rethink this attempt to, be more liberal, no, as far as these controls are concerned. My sense is our big pitfall forthcoming is, number one, overestimating our achievements. We're despite everything, we're still in a manageable situation, both at the NCR, at the national level. We have some problem in Cebu at the moment. We're very confident it will be resolved in time, at least largely because the Cebu local government is better prepared than it was 6 months ago. But the big threat to us, no, is overestimating our achievements and underestimating the virus. And from a policy standpoint, whenever that we feel that happens, things go bad, no, and could go bad for us very quickly, given the great possibility that this variant, this more contagious UK variant, is already here and spreading in our communities.
Yeah, and I'd like to add to that, in other countries, for passengers entering a region, they have a mandatory 14-day quarantine. In some countries, it's 21-day quarantine. So one of the naging pitfalls natin, I think, is when someone tests negative, then they let that person go out na, parang, okay, you're free. But sometimes the symptoms don't manifest, or the viral load doesn't build up in that period of time. So it takes a longer time for the viral load to build up. And that's why I think we should really require yung 14-day quarantine. It should be mandatory. And we should be really strict about our borders. So if they're opening, relaxing the travel ban, they should at least be very, very strict about our border policies, not let people in. And there's also the concern about some people having fake PCR test results na nakalusot. So we should be strict and vigilant about those things.
Okay. Professors Guido David and Ranjit Rye of OCTA Research. Professors, maraming salamat po for joining us tonight.
Maraming salamat.
Thank you. Good evening.
Thank you. Good evening.
We'll just go into a break, so please stay with us.
Welcome back, the Chiefs here on One News. Now joining us is DOH Region 7 Chief Pathologist and Spokesperson, Dr. Mary Jean Loreche. Good evening, Doctor.
Good evening po.
Good evening, Doctor.
Good evening po.
Hi, good evening. Ma'am, we've been talking about Cebu because, well, the latest report that we're getting, kanina binilita namin, 1.61 daw yung reproductive rate, and then we just got an update from OCTA Research, sabi the latest figures is now 1.65. In any case, experts are saying we haven't seen numbers like that since June. OCTA is saying this is now a matter of serious concern. First of all po, maybe you could validate for us on the ground what it looks like in Cebu, and from your vantage point, what's going on?
Okay, so we actually have a rising number of our cases, and that is really on the ground data, whereby we have seen a double-digit number for the past few weeks, and suddenly this yesterday and I think today we have a triple-digit number in terms of newly confirmed cases. And of course, our active cases also has increased. But then we have to also look into not just the rising number of cases, but our capabilities to handle this number of cases. Malayong-malayo po yung ating situation nung tayo po ay naging epicenter sometime May, June, and July. Sa ngayon po, I believe that our healthcare, our capacity to be able to handle this rising number is actually in place. Secondly, mapapansin din po natin that although, and that is correct, no, that our reproductive number is mataas, and we see that on the ground, there is a clustering of cases. Kaya ang alam po namin, kahit na meron kaming pinadalang samples doon po sa Philippine Genomic Center noong January 7, January 20, at saka January 21, na hindi pa bumabalik din sa amin ang result kung ano man yon, we still, we believe no, na hetong variant na ito could probably be just here also. Hindi naman natin maipagkakailayan na hetong mga variants na to, there might be an increase in the transmissibility. Pangalawa, na-notice din natin na there is more awareness no, of the people. Meaning to say, pagka may nararamdaman sila, sila po ay nangungonsulta na ng mas maaga. So kung titingnan natin yung aming healthcare, no, ito yung ating dapat tuunan din ng pansin. Yung aming healthcare, critical care utilization, kung pag-usapan natin yung data kahapon, ay nasa 25.1%. Ibig pong sabihin noon, ang allocated beds natin for COVID sa lahat ng pribadong ospital is 897 at ang meron tayong admissions ay 225, 213 sa regular COVID wards at 12 sa ating intensive care unit. At saka dito po, mapapansin din natin na a portion of these active cases na naitala at yung ating mga bagong kaso, karamihan po sa kanila naman ay asymptomatic. And after the asymptomatic, the greater volume would be coming from the mild cases na nakikita natin. So mapapansin natin na all of this increase in the numbers is relatively because also of a very good active contact tracing team that we have. So nahuhuli po natin kung nasaan sila. Ang ating pong Emergency Operations Center dito sa Cebu ay very efficient naman. And kami nga po ay nagagalak at nandito na naman po sa amin ngayon. Bumalik po sa amin si General Mel Feliciano at saka si Ma'am Mia, yung kanya pong partner, no? Kanyang better half niya. And so we are again into looking into where or the problems are, bakit ganito kataas ang aming kaso. Pero we still attribute it to really people movement that has been occurring the past several weeks.
Doctor, you're talking about people movement. Acknowledge naman kahit ng OCTA yung maganda nga daw ang ginawa sa Cebu, ang bilis-bilis na contain. And they said they warned actually about 3 weeks before the surge. Last year, ang bilis-bilis nangyari nga yung surge, pero ang bilis-bilis naman daw ng containment. At this point, ngayong may ganitong warning and you have this variant at magli-lift na naman ng mga travel ban, do you think Cebu should be reverted to a stricter quarantine, balik sa GCQ?
Hindi po. We believe na hindi kami dapat ibaba or i-down, kumbaga, huwag naman kaming ibalik sa GCQ just because our numbers are rising. We are capable of handling this rise in the numbers. Sinabi ko na nga po, yung ating mga temporary treatment monitoring facilities or isolation facilities are in place. Ang ating pong mga hospitals are ready. We have healthcare workers who are ready also. At sinabi po natin na yung sa ating classification dito sa Department of Health mismo, in terms of safety level, no, para masabi natin na nasa danger zone ang isang lugar, lalo na kung hindi nila kayang gampanan yung kanilang rise in cases, nasa safe level tayo. 60% ang sabi nga ng ating healthcare capacity dapat. Tayo po ang ating nagagamit, nasa 25% pa lang po.
Ma'am, it's good to hear na your healthcare system is very ready for whatever happens. However, still the fact is na ang laki po ng tinaas ng inyong infection rate, and I suppose that still is alarming. Do you have any suspicion as to why this particular increase that going to triple digits? You did mention kasi movement of people pero yung pag MGCQ po ba ng Cebu, when did that happen? And is that correlated to the increase in numbers, or could there be something else?
We have been in MGCQ nung magsimula po tayo ng September, October, November, December, ikalimang buwan po natin ito ngayon.
Okay.
Mapapansin natin, nagsimula pong tumaas yung mga kaso natin dito after the holidays. So post-holiday surge ang namin doon. Pero nitong mga huling araw, napansin natin na mas mabilis ang dami ng ating mga bagong kaso. So in a way, it can be a cause of alarm for the rising number of cases, but then we need to balance it also with our capacity to handle these rising numbers. So ang amin nga, we are actually, as a matter of fact, we have written a letter yesterday already that we be allowed to do biosurveillance, meaning to say, we really want to do testing at a very strategically, of course, for biosurveillance, for genomic sequencing. At tatlo yung aming areas na gusto naming kunan para malaman talaga natin. Dahil nga po, yung mga dumating dito na naka-quarantine sa atin na galing doon sa mga restricted countries na nakapagdala tayo ng samples doon sa PGC, hindi pa bumabalik yung result. So now, because we are thinking that it may be a variant or maybe another variant that is here, we would want to do testing of areas where there is a clustering of cases. Minsan kasi napansin natin, in a particular household, gaya dati, nung araw pagka isang household, dalawa lang ang nagpo-positive. Ngayon, meron na tayo na yung buong pamilya positive na sila. So we want to test that at random. Second, yung ating pediatric population, napansin din natin na medyo tumataas din po yung ating number of cases. So we want to test these children also, na yung mga naa-admit sa ospital, kung meron din ba talagang variant na affecting these children. At pangatlo, yung mga nakatag na mga cases natin na sinasabi nating reinfection, meaning to say, nag-positive na siya, and then 3 months after, bumalik ulit, nag-positive siya. So gusto natin mag-sample dito kasi yung amin pong ginawa dati, nung naging epicenter kami, and even before that, was actually we were very aggressive in our testing. We were able to conduct our seroprevalence. So we were able to predict on what to do next. So ngayon, gusto natin gawin ito ulit, ang ating strategic biosurveillance testing.
Ma'am, so you want to do your own genome sequencing sa Cebu? Is that correct? Am I getting you correct?
We have no capacity to do genomic sequencing. Alam naman natin, si Philippine Genomic Center lang meron yan, at si RITM at si UPNIH, no? So ang gusto namin i-recommend, kasi very strict ang guidelines natin on the sending of samples to the Philippine Genomic Center. At naintindihan naman natin yan. Kailangan history of travel to a restricted country na nag-positive sa RT-PCR. Pangalawa, kailangan yung cycle threshold niya ay 30 and below, no? At saka may volume yan na hinihingi. Ang sinasabi po namin dito, because of this rapid increase in the cases, at wala naman po kaming confirmed case talaga ng UK variant as of the moment, gusto namin mag-sampling para dito and ipadala sa kanila, And hopefully, we would really be able to pinpoint why the rapid rise in the cases. Kasi alam naman natin si UK variant B117, isa sa kaniyang, the effect that it has or the impact that it created is actually the increase in the transmissibility. Yun yung sinasabi natin na pwedeng mag-increase ang kanyang transmission rate affecting around 60 to 70% more individuals.
At saka mas infectious daw siya sa children. You mentioned children that you want tested. How many children are we talking about? And ano yung age range nila, yung mga gusto niyong ipatest?
Basta mag-positive. So gusto ko lang naman may criterion din naman kaming ilalagay. Children, meaning to say under 16 years of age na nag-positive sa SARS-CoV-2 na admitted, gusto natin i-test yan. So, kailangan ko din naman sundin yung cycles threshold kasi I'm also a practicing pathologist. So, I know that the cycles threshold will have to be considered, but we want testing, meaning to say, if we will be allowed to get samples in these 3 various populations na binanggit ko at random, strategize ang testing. Kukuha tayo ng sample, papadala natin sa Philippine Genomic Center para mapag-aralan din nila kung meron na nga ba kami ng variant na yan. That's one way of looking at it. The second way of looking at it also is this. Because again, people are more aware, so they really have themselves tested. Nung araw, mahirap ipatest ang tao kahit na sabihin natin na talagang nagka-clustering na, pupunta kami sa kanila. Minsan ayaw magpa-test, takot pa. Ngayon, yung kusang loob na gusto na nilang magpa-test, gusto nilang malaman kung ano yung situation nila is already there. The acceptance of the testing is there. Yung capacity natin to conduct testing ay napakaganda po dito sa atin, sa atin sa Cebu City at sa aming karatig na highly urbanized cities. We are capable of running around 7,000 in a day kung ma-maximize natin both government and private molecular laboratories. Pero hindi po kasi yan lang ang basihan natin Kailangan din pong tingnan natin yung aming kapasidad to be able to do isolation and contact tracing immediately. At nabanggit ko nga po, dahil sa aming Emergency Operations Center na very active naman, napaka-aktibo po ng ating contact tracing at saka isolation natin.
Okay, ma'am, maraming salamat po, Dr. Mary Jean Loreche. Thank you for joining us tonight.
Thank you po.
Ingat po.
Yes.
Maraming
Thank
salamat
you.
po.
And now joining us in this late stage of our conversation is Navotas City Mayor Toby Tiangco. Mayor Tiangco, good evening po. And again, thank you for joining us in the Chiefs.
Good evening, Mayor.
Good evening, Ed. Good evening, Ami.
It's good to see you again. Wala na kayong sombrero ngayon kasi usually nakasombrero na kayo. Well, Mayor, teka, pabalita muna. How are your preparations going for the vaccine, the arrival of the vaccines? Well, actually, the purchase before the arrival.
Yung purchase, nagka-EUA na kahapon yung AstraZeneca, no?
AstraZeneca.
So mas maliwanag na ang path for Astra na makarating. Kaya lang, doon pa lang sa pag-uusap namin noong January 10, talagang ang commitment ng Astra is July pa ang earliest delivery, no? So matagal-tagal pa 'yon. Ang pinaghahandaan talaga namin ngayon is yung Pfizer kasi yun ang unang darating sa national government, yung COVAX, through the COVAX facility, no? Darating yan ng February. So as I mentioned to you last time, bumili tayo ng ultra-low temperature freezers at ng mga transport boxes. Itong mga boxes na to will be used to transport the vaccines from the cold storage facility to the vaccination centers, maintaining the required minus 70. So kanina po, yung unang dry run was done earlier this morning, and they told me that they will do another dry run on Wednesday to improve the process.
Mayor, ano yung mga nakikita nyo, sir, na kasi yung ibang mayors nagda-dry run na rin Sa ngayon, ano yung mga nakikita nyong problema with your dry run? Diyan sa vaccination program.
Yung challenge kasi talaga doon sa Pfizer is to maintain the minus 70, no? So we have to be very careful with that, no? Tapos dapat i-time and motion kung gaano katagal ba matutunaw yung minus 70 frozen na vial na maging liquid siya. And then, doon sa guidelines ng, uniform guidelines ng Department of Health, ang nakasulat kasi doon is first of all, pagdating ng tao, interviewin siya, magkakaroon ng physical examination. After the vaccination, he has to stay there mga 30 minutes. So ang tinitingnan namin is kung kaya ba talaga yung per vaccination site, magagawa ba talaga namin yung 100 persons ang ma-vaccinate per day per vaccination site.
Mayor, for a time, ang pinag-uusapan dito was whether or not LGUs can negotiate for themselves yung mga bakuna. And mukhang nagkalinawan. But I'm just curious how it's gone so far. Mas malinaw na nga ba yung protocols between LGU, the national government, and the vaccine manufacturers? And how has that in particular worked out for your city?
Still hindi pa pwedeng direkta yung yung local government unit. It has to be a tripartite agreement, no? That's why nga nauna yung AstraZeneca kasi yun yung unang pinirmahan ng national government. And then yung Moderna, they have asked us kung ilan yung gusto namin orderin. We have told them already and we're just waiting for the signature of the national government. Then we will sign again. So all the pharmaceuticals, it is their policy that they will not sell if the national government has not signed because yung kanilang pagbenta at pagbili ng local government should be part of the national vaccination program.
Okay. So that's settled for now. I mean that's the working arrangement for now, and yung mga LGUs are happy with that arrangement, or is this still something that's still being taken up?
No, we're happy with it. No, that's the protocol of the agreement. Now we go into the payment process. No, so yan na lang yung fina-finalize ng national government. Yung payment procedure, pinag-uusapan pa ng national government, and they will have to finalize that as soon as possible. And they have committed naman that they will finalize the payment procedure kasi di ba ang dami naming LGUs na bumili ng Astra, no? So that there will be only one procedure to be followed by all the LGUs that purchased AstraZeneca.
Ay, who makes the decision as to, kasi sabi nga ninyo, ang daming LGUs na bumili ng Astra, who makes the decision as to which LGU gets the vaccines first? At least in terms of the purchases by the LGUs of the vaccines, hindi yung mismong national government purchase.
Hindi, ang mangyayari doon, sabay-sabay, in tranches kasi yan eh. So I think the fair thing for Astra to do is they would distribute it proportionately to the number of vials that you have ordered, no? Kasi ang nangyayari doon is batches by batches yung sa Astra. Yung sa batch ng LGU, sabay-sabay yon. So kung hindi nila madadala yon, I think the fair thing to do is percentage. Kunyari, ang 5% of the total order, then everyone gets 5% of the total order. Siguro that is the fair arrangement.
But
Mayor, you came out openly in public, sabi nyo, hindi nyo tatanggapin yung Sinovac vaccine. Have you been sounded out actually by the national government? Tinanong naman ng mayors.
I will clarify. I will clarify. I did not say that we will not accept the Sinovac vaccine. Ang tanong kasi sa akin doon, I think it was in one interview, tinanong ako kung ako personally, payag ako magpabakuna ng Sinovac vaccine.
Takot ka raw.
Sabi ko, takot ako doon sa Sinovac kasi, I mean, yung reason ko, that's why I'm worried about Sinovac, is because it's the first time I've heard about this company. Hindi katulad Pfizer, o nadidinig naman natin yung Pfizer, di ba? And the other Western drug companies. Alam natin. So itong Sinovac, first time ko nadinig yung Sinovac. I mean, kung hindi nagkaroon ng COVID-19, I'll never probably hear about Sinovac. So ako personally, medyo worried. Kasi ang tanong sa akin doon, payag ka ba magpabakuna? And I was honest enough, payag ako basta yung 3 brand lang. Sabi niya, anong brand? So sinabi ko, Pfizer, Moderna, o AstraZeneca. Aba, yung Sinovac, hindi ka ba papayag? Sabi ko, medyo kabado ko dyan kasi hindi ko naman kilala yung brand na yan. But doon sa Navotas, ang ginawa namin is orderin namin yung Pfizer, orderin namin yung Moderna, na-order na namin AstraZeneca. And when the Sinovac becomes available, we will offer it to our
Yeah.
constituents.
Yes,
Kasi
yes.
may mga tao naman na iba-iba yung tao pero ayaw magpabakuna. Merong sasabihin, ay gusto ko yung itong brand. Meron naman sasabihin na kahit anong brand, basta mabakunahan na ako kaagad, gusto ko naman pabakunahan agad. So whatever is available, we will offer it. We will not block any brands. So
Yes,
I hope that's clear.
Mayor,
I do
Mayor, the last time you were...
Sinound out na kayo ng national government. Nag-coordinate na sa inyo national government.
Always, they always coordinate with us. Actually, last...
No, on Sinovac. On Sinovac.
Yeah, sinasabi naman sa amin Sinasabi na ang unang darating is Sinovac and Pfizer. Yan ang sinasabi sa amin.
Mayor,
So, but you know, yung Sinovac, it's not as temperature sensitive eh. That's
Yes.
why yung preparation is not that difficult eh. Hindi katulad nung Pfizer, kaya doon kami naghahanda because nga of the temperature requirement.
Mayor,
Yes, Toby.
the last time you were here, we were talking about, the information campaign and the public campaign that must be waged para tumaas ang confidence ng mga tao. Pero that question was raised on the premise na we already knew na mababa at that time yung confidence ng mga tao, perhaps until now. And you said, then, teka muna, the next question for us is bakit ba? We want to know, we want to find out exactly saan ba yung pangamba ng mga tao, ano exactly yung concerns nila. Do we have an update on that? Or do you have a clearer idea now kung ano exactly ang pangamba, ang hesitation ng mga tao? And does that give you a clearer idea on how to proceed with a public affairs, with an information campaign?
Yeah, there are dalawang pangamba. Isa yung Dengvaxia, yung stigma pa rin nung Dengvaxia, no? Yung iba naman, kaya pala no, tignan muna, hindi naman totally no, tignan muna nila yung mga unang nabakunahan.
Mauna ka, ganun. Mauna ka.
Okay.
Parang ang sagot nila is no. Bakit no? Gusto ko muna makita kung yung mga naunang mabakunahan. So hindi pala totally no yon. It is a qualified no. No, ayaw namin, kasi hindi naman sila pwede sumagot ng yes. Kasi hindi naman sila yes. Hindi naman sila pwede depende sa brand. No, gusto namin makita muna yung mga naunang nabakunahan. So parang ayaw lang nila mauna.
Well, Mayor, I have two questions for you. Magkasunod eh, sorry Pero
Yes.
una, are you willing to be vaccinated in public if only to dispel if only to reinforce yung vaccine confidence, if only to show people that it's okay to be vaccinated? That's number one. Number two is, kung naunang dumating yung Sinovac, we know your preference for Pfizer. Kung naunang dumating yung Sinovac siyempre, I understand, mag-aalok mo na yung national government ng bakuna eh. And then, saka darating yung preference ng LGUs. So, mauna yung national government kahit paano. So, what would you do?
Okay. Number one, ako, willing akong pabakunahan in public. Basta yung tatlong, as of today, no, yung tatlong brand. Pfizer, Moderna, o AstraZeneca. That's why I'm saying as of today, kasi daily naman, siguro naman, pare-pareho tayo na daily nagbabasa tungkol sa vaccine, no? Malay ba natin na by the time na dumating yung Sinovac, malay mo, kumbinsido na ako na okay yon, no? Number two, pag dumating yung Sinovac, at kahit hindi ako kumbinsido, I will still offer it to our constituents. Lahat ng darating, i-offer namin, we will administer it to everyone who wants it, no?
Yes, sir.
But
Yes, sir.
daily naman,
Understood.
kasi may mga nagsasabi rin naman, in fairness, no? May nagsasabi rin naman na yung safest is yung Sinovac, no? The only reason talaga is because wala akong alam na gamot na ginawa ng Sinovac. Hindi tulad yung Pfizer o yung ibang mga brands. Madami tayong alam na gamot na ginawa nila eh. So kaya sinasabi ko baka by that time.
Yes, sir. Sir, does that mean you will defer your inoculation until your preferred vaccine comes along?
Ako?
Yes, sir.
Personally?
Yes.
Yes.
Yeah, but we appreciate I really appreciate your candor. But to be honest, I'm trying to anticipate now what your constituents are seeing, because they will hear you saying, "Ako mismo, kinakabahan dyan sa ako mismo ngayon ko lang." And I'm sure that's echoing real sentiments and real sensible statements from a lot of people. But but wouldn't that in effect have the effect in your constituency at the very least na I'm with Mayor, hanggang di dumadating yung kahit nandiyan pa yung Sinovac, matetenga yan dyan dahil kung ang mayor ko is very open about the fact na mahirap na yan, ako rin.
Hindi naman siguro because yung city health officer namin is free to give her own opinion. And siya yung eksperto dito. It's just a personal matter for me, di ba? Siguro naman kung yung city health officer namin ay magsasalita at sasabihin na siya ay kumbinsido doon sa Sinovac, wala naman magiging problema. And I think it would have been an issue if we did not give the choice to our constituents, di ba? Ibig sabihin kung double standard, sabihin ko, ay ako ayaw ko, pero kayo kailangan. Ito naman, di ba, sinasabi naman natin, ever since the beginning, that is the reason why we did the survey. Para yung bibili namin ay yung gusto ng tao. Kasi ito ay, ang pagbakuna ay voluntaryo, di ba? Hindi mo pwedeng pilitin. So it follows, sa tingin ko, na hindi mo rin pwedeng pipilitin doon sa brand. Kasi maaring payag siya magpabakuna, pero mag-iintay siya doon sa brand na gusto niya. Yun lang ang mangyayari. But again, sinasabi ko pa rin na ako naman as of today, di ba? Pwede naman magbago yan. Titignan naman natin kung ano yung mga nababasa natin, titignan natin kung may makakakumbinsi sa atin na doktor, pwede pa naman magbago yun.
Of course, it will help a lot kung mauna yung national government. Do you think, Mayor? Mga national government official.
Magpabakuna sila muna.
It will help a lot to improve confidence.
In public.
Mauna yung national government. Magpa-election in public. Don't you think so?
It will help, but again, I said it's purely voluntary, so it should be voluntary for everyone. It should be voluntary whether kayo ay regular citizen o kayo ay government official. Ang importante lang naman dito is there's no double standard. Whatever is the policy should apply to everyone. Diba? So ako, sinasabi ko, okay lang naman sa akin na in public. Wala namang problema doon.
Okay. Always a pleasure to have you with us, Mayor Toby Tiangco. We hope to have you again soon.
Yes.
Thanks, Mayor.
Salamat po.
Stay safe, stay
Thank
safe.
you po. Ingat po.
Bye-bye.
You too.
Bye.
Okay. That'll be all for this weekend edition of The Chiefs. We hope what was discussed here will keep the conversation going. I'm Ed Lingao.
I'm Mami Paminton of the Philippine Star.
I'm Robbie Alampay and we are One News.